Thank you very much. Good evening, everybody. If I call the meeting to order, I'm Councillor Ian Edwards, Leader of the Council and Chairman of the Cabinet meeting. Warm welcome to anybody who may be following us online. There being members of the public present, I will dispense with our normal health and safety announcements. However, I will ask or remind colleagues, please, to have your mobile devices turned to silent. Thank you. So we'll kick off straight away, please. And I notice that everybody's present, so we can go to item 2, declarations of interest. Are there any additional declarations, colleagues? There are none. Great. Approve the minutes of the last meeting. That's pages 1 to 12 in the pack. Are they agreed? Agreed. Thank you. And this is to confirm that there are items of business in both Part 1, the public meeting, and Part 2, the private meeting. When we get to the Part 2 agenda, we will drop the YouTube link, as these are matters of confidence. However, the decision is published at the end. And we will now turn to the substantive items with Part 1. So this is agenda item 5, the report of the External Services Select Committee on Children's Dental Health. Councillor Dennis, please introduce the excellent report of your committee. Thank you.
Thank you very much, Mr. Chairman, and thank you for inviting me to present this report. As the report states, this is an important matter which has been known about for a while, but the committee found there's some good news to be had and lots of good work that was happening, which could, if it was reconfigured, would lead to some really good outcomes. So I'm not going to go through the 9 recommendations because they're there in the report, but I just wanted to highlight 3 of them, which I think give a flavour of the type of things which can be done to improve children's dental health care in the borough. And the first one is recommendation 2, which is about units of dental activity to be carried over to the next year and can be spent on prevention. So in NHS dental contracts, there are these things called UDAs, and they're given to dentists or dental practices. And if those dental practices don't use those UDAs, then basically it gets subsumed back into the NHS and gets lost. So the latest figures we have show that £10 million a year is lost on NHS dental care in London alone. Now, this is a false economy because each year the NHS spends over £3 billion on emergency dental care, and the vast majority of that is easily preventable. Now, of course, those dentists who aren't able to use their UDAs are not going to be able to probably use UDAs extra if we carry them over. So we recommend that those UDAs aren't used. The money is basically then used the next year for preventative programmes to try and cut down that £3 billion of spending. Recommendation 5 is that dentists work together to agree a way where no child under 11 cannot get an appointment. Now, the NHS can force GPs to take on patients, but there's no statutory power to do so for dentists. But because there's no statutory power to do so, doesn't mean it shouldn't be done. And having spoken to dentists who are healthcare professionals, they have a moral obligation to provide dental care, especially to young children, because as well as seeing things early, it's one of the best ways of educating people about how to look after their teeth. So, it's something that even though you don't have to do it, it should be done and can easily be done, I think. And then recommendation number 9 is that the Health and Wellbeing Board take an interest in coordinating this work. Now, there's lots of little good stuff going around, but there isn't really strategic linking to make it work as well as it could. And also, there's lots of really good work going on in promoting just general health, especially for children. Now, oral health can be added to those things quite easily to improve the sort of knowledge and performance of oral health. So, and also, it'll make oral health in the borough for children accountable to the local council and to other stakeholders. So those 3 recommendations show how basically reconfiguring how we work at the moment, we can hopefully get some really good outcomes in this area. So thank you for letting me present this report.
Thank you very much. Councillor Palmer, you wish to speak? Thank you.
Thank you, Leader. Thank you, Councillor Dennis. The report before Cabinet is an exceptionally well-written, detailed and comprehensive document. It sadly illustrates that young children in Hillingdon have higher levels of dental decay than is average for England and in North West London. We are high up in the table for our 5-year-olds in North West London statistics. There is evidence before us that shows the preventative value of good early start dental care. It obviously helps prevent decay and tooth extraction due to decay, but it also helps with preventative health such as respiratory and cardiovascular disease. The simple fact of being able to show your teeth when you smile or present yourself to your peers or later at an interview is what we all wish to have. Our mental health can also be affected by the way we look. As Cabinet Member for Health and Social Care and in my role as Co-Chair of the Health and Wellbeing Board, this excellent review will be used, if the report is agreed by Cabinet tonight, to help address the issues and barriers as outlined by the Select Committee and the witnesses they met with. The report recommends that I write to the Secretary of State for Health and Social Care and that I liaise with Pan-London counterparts. With reference to recommendation 3, I wish to assure Councillor Dennis that dental health inequalities are already being discussed by me with my North West London colleagues. Thank you to all members of the committee and the report author for this excellent report. I put the recommendations before Cabinet tonight and hope that we all agree them. Thank you, Leader.
Thank you very much. I'd also like to endorse great thanks to yourself for your leadership of the inquiry and the members for their contribution that's made. It is a great report here and shows the value of having dedicated select office, select committee work supported by democratic services who have produced a good report. For us to give effect to this, it is through the Health and Wellbeing Board and elsewhere. We only have influence for rather than direct control. And I know that we are working exceptionally hard to maximise our influence and ensure that the governance structures are right to enable us to work closer and more effectively with our health colleagues. I welcome these recommendations. I thank you for your work. Colleagues, are these recommendations agreed?
Agreed.
Thank you. Thank you very much. Can we turn to agenda item 6, please, the Statement of Community Involvement. Councillor Lavery.
Thank you, Leader. The revised Statement of Community Involvement is returning to Cabinet. The original report was presented in June. It then went out to public consultation, and I'm grateful to the members of the public and those organisations who have submitted detailed responses. These have now been considered and are incorporated into the revised report, which details how we will consult members of the community regarding planning and planning documentation. So I commend the report to Cabinet and ask that the 2 recommendations on page 42 are agreed.
Colleagues, are these agreed?
Agreed.
Thank you. Agenda item 7, the London Borough of Hillingdon Enforcement Policy. Councillor Riley.
Thank you, Leader. The report is on page 119, and the recommendations are that Cabinet approves the adoption of the enforcement policy and instructs officers to review the policy in 2024. What members may find interesting, in particular, on page 3 of the policy itself, because this the document sets out the enforcement policy, are the 14 areas, Leader, of various activity, ranging from animal welfare to antisocial behaviour, with a number other areas in between, a vast array of different areas which our officers deal with and control. And indeed, in each one of them, in the recent past, we've had considerable success in regard to enforcement and implementation. So I'd like to commend our officers for the work that they do in these areas, and in so doing commend this report to Cabinet.
Thank you. Colleagues, this is typical of a number of our policies where we are giving transparency to our residents of how we operate and what they can expect from us. And I'm very pleased that we do take these steps and we do produce such documents and policies for public inspection. Colleagues, are these recommendations agreed?
Agreed.
Thank you. Agenda item 8, the consultation on changes to school admissions arrangements. Councillor O'Brien.
Thank you, Leader. I would like to propose agenda item 8, consultation changes to the school admissions arrangements. The recommendations are set out on page 140. Cabinet recommends the changes to be made to the school's admissions criteria and authorises officers to undertake a full consultation exercise in relation to firstly, the school admissions criteria, to amend points of measurements for two schools, infants and junior schools, at Whiteheath Infant and Nursery and Yedding Infant and Junior Schools. They are set out in Appendix 1 of the report. There are no other material changes required to the admissions criteria for community schools. And just to set the background, measurement points are used only for admissions criteria when a school is oversubscribed, and that allows local children to go to local schools. Distance measurements are monitored using the socio-geographical data, and that can change from time to time, and that's what we're seeing here this evening. Secondly, the published admission numbers, the PAN numbers, to undertake a full consultation exercise in relation to the reduction of PAN in 4 schools. Harefield Infant School reducing from 3 forms of entry to 2. Harefield Junior School reducing down from 3 forms of entry to 2. Harlan Primary School down from 3 forms of entry to 2. And Field End Infant School from 4 forms of entry down to 3 forms of entry. Officers consistently review school places to ensure its statutory responsibility that there is sufficient school places for resident children of Hillingdon. The forecasting evidence over the last 4 years has indicated in primary schools that there are residual school places in the system. And although this is not a financial burden to the council, it does impact schools themselves by having part full year groups. A reduction in PAN for the named schools will still leave the council in a position whereby it still meets its statutory duty and helps schools with their planning of resources. The schools have been selected in primary planning areas, and that's geographical sectors, to ensure that we have sufficient coverage across the borough. The consultation will commence following this cabinet meeting, will last for 6 weeks, and the outcome will come back to our February cabinet meeting. I should add at this point that it is very likely that council will in the next year receive further proposals to consult on the reduction of PAN in more schools. However, we are noticing movement incoming into the borough, and a close eye will be kept on all school places. I therefore move this recommendation.
Thank you very much. Colleagues, are the recommendations agreed? Agreed. Thank you. Agenda item 9, the procurement of temporary accommodation placements utilising a dynamic purchasing system. Councillor Lavery.
Thank you, Leader. The report before us tonight is in regard where we need to purchase temporary accommodation, and it is in order to ensure that we get quality assured providers, a clear choice of providers, and best value in terms of market by having set up landlords to whom we will go. We do have a need for temporary accommodation. We are aiming to reduce this need as far as possible, but it will never be possible to eliminate it totally. The system will have 3 lots in it, effectively spot purchases of bed and breakfast, that's where we need one for maybe a night, maybe 2 nights, maybe 5 nights. Self-contained accommodation, which is the same thing on larger size, but also block bookings. We will be pursuing more of these because they do give us better value over time. We will always need the emergency ones because we can never forecast the exact daily or nightly demand. But if we can get more stuff that we are paying for permanently, it will lower our costs. There are 2 recommendations in the report. One to approve the DPS, Dynamic Purchasing System, and also the second recommendation to recognise there will be occasions when it is either not appropriate to use it because there is a crisis or that we've got no spaces left in it. So I commend the report to Cabinet.
Thank you very much. I welcome this one. I welcome our approach here of trying to better manage our supply chain, driving up standards and reducing cost. I think that is very much in keeping with our approach as a council. So, colleagues, is this agreed? Agreed. Thank you. Agenda item 10, the appropriation of land at the former Useley swimming pool and Falling Lane, Useley. Councillor Bianco.
Thank you, Leader. Well, this whole saga dates back to 2010, I believe, when the swimming pool on that site was closed because it was no longer fit for purpose. And indeed, it was demolished, I should say, in 2011. Subsequently, in 2017, this Cabinet authorised the development of this site
for residential development and for a new library. As part of this site, or most of this site, has a restrictive covenant that the land will be held for the purposes of public walks and pleasure grounds. You can tell that the covenant in question is of some age. It is necessary for us to take action to redeem that covenant, and in so doing, the way forward is to advertise and invite people to come forward if they want to object. That is the purpose of the report. That is the direction of the two recommendations on the top of page 174, and the first of which authorises officers to make the public notice, and the second one delegates to yourself, Leader, and myself, along with the Corporate Director of Infrastructure, Transport and Building Services, to consider any objections that are received. I so move.
Thank you very much. Having been a councillor for Useley and having understood the demands from residents that we put to good use that vacant piece of land, I very much welcome this move. Colleagues, are these two recommendations agreed?
Agreed.
Thank you. Number 11, Transport for London Local Implementation Plan, the Delivery Programme. Councillor Riley.
Thank you, Leader. The paper appears at page 183 with the recommendation that Cabinet delegate authority to myself to submit the Council's Local Implementation Plan 22-23 Delivery Programme bid to Transport for London no later than the week commencing the 1st of November of this year, and further bids to support the new 3-year delivery plan as required by Transport for London. Leader, this is a good news story, to coin a phrase. It's the beginning of the release of funding from TfL, who've had a very poor time of it in the recent past. And you will see on page 185 at paragraph 9 that the themes, and some of the themes, deal with cycling, walking, bus priority, and in particular road safety, all matters that we are promoting and aiming to achieve by virtue of this funding. And I commend the recommendation to Cabinet.
Colleagues, do we agree?
Agreed.
Thank you. Number 12, the annual report of adult and child safeguarding arrangements. Councillor Palmer.
Thank you, Leader. This is to inform the Cabinet and our residents about the way in which the Safeguarding Partnership has performed over the last year. The report before us is the extensive summary of the excellent partnership working that takes place to support and safeguard Hillingdon residents, both adult and children. The report has also been presented to the Families, Health and Wellbeing Select Committee, and my thanks for their scrutiny. It covers a period of unprecedented challenge for residents and those agencies whose duty it is to support and safeguard. It is to the credit of this Council and its Safeguarding Partnership that it continued to be business as usual during this difficult time. Our safeguarding was the subject of an independent expert review during January and April 2021. It is with pride that I can state that the independent scrutineer found that the local partnership met its statutory responsibilities and no areas of poor practice or weakness in safeguarding arrangements were identified. In fact, he stated the partnership is one that is built on high support, high challenge, and where difficult conversations are encouraged. There are numerous examples in the report of good work across adult and children's services from a council perspective. In adult services, there was a significant increase in referrals during the pandemic, with social care staff adapting to visit homes safely by video call and showing flexibility and resilience. Maintaining the risk associated with domestic abuse is a key priority for adult social care, and sadly, these referrals increased during lockdown. Collaborative working with police continued well during this time, and staff were reminded to review safeguarding plans, as home working is not a safe space for everyone. Training continued by being offered remotely and was offered in some of the following areas: child sexual exploitation, adult safeguarding, reducing parental conflict, and intimate partner violence. The adult MASH is now located with the children's MASH, and this has strengthened our collaborative approach to safeguarding and Think Family. There is so much depth and strength in this report, but before I pass on to my colleague Councillor O'Brien, I will end with the statement that it is to the credit of the partnership that in the face of extraordinary pressure, progress has been made against all priority areas, thanks to all social care and our other partners.
Thank you. Councillor O'Brien, you wish to speak? Thank you.
Thank you, Leader, and thank you to my colleague, Councillor Palmer, who has introduced tonight's agenda item, the Hillingdon Safeguarding Partnership Report for 2020-2021. I'll keep my comments to the Hillingdon Children's Safeguarding Partnership. So the report highlights the collaborative working between partner organisations to ensure that during the extremely challenging year of the COVID pandemic, safeguarding arrangements have had to be fluid and adapt to the changing circumstances to keep our identified children safe, as well as new referrals that came in to the attention of the multi-agency teams. New ways of working had to be introduced to ensure children were seen during lockdown, and the relationship with schools and panel user groups were made all the more important. I welcome the comments on page 5 of the report, that is page 199 on the Cabinet report, that independent scrutineer found a good relationship had built up between partners, a willingness for the safeguarding partners to work together to seek out vulnerable children and to provide them with the assistance they required, and the good practice of communications with newsletters, practical tools, and with operational updates. The vision of Hillingdon's Safeguarding Partnership is for every child and young person to feel safe, enjoy good physical, emotional and mental health, have pride in their unique identity, feel that they belong and have opportunities to thrive. The partnership aims to achieve this goal every time and for every child. The priorities for 2021 were working with children and young people in the areas of high risk of exploitation, neglect, which has become all the more apparent in this last year, children with complex needs and disabilities, safeguarding in education and requiring early help interventions. The work that has been achieved in this report is continuing into 2021 and 2022, and the priorities remain similar but with the addition of child sexual abuse. I thank all the officer teams and partnership organisations that have worked together to change the lives of young people in this borough. I support this recommendation.
Thank you very much.
Thank you.
Again, another good report. It highlights to me the reliance upon our partners for us to be truly successful as a council, and the steps that we go about to develop the strength of those partnerships and their achievement. This is just one example of where it is becoming more visible to our public, our residents, of how we work together and the efforts that go in behind the scenes to ensure that people are kept safe. I also welcome this report. Colleagues, are the recommendations agreed? Thank you. Agenda item 13, the Revenue and Capital Month 5 Budget Monitoring Report. Councillor Goddard.
Thank you very much, Leader. This is the Budget Monitoring Report for month 5 of 21-22, the current financial year. This report of the financial results of the Council is for the year to date as at the 31st of August 2021. And this is set out on page 243 of the pack. The last financial position reported to Cabinet was at month 3, which was June 2021, and therefore I am reporting to Cabinet on movements in our financial position from month 3 through to month 5. It must be pointed out that this continues to be a challenging financial environment for the Council. Not only have we had the distorting impact of the costs and the pressures which come with the pandemic, but also now we're having to deal with the impacts of inflation. However, looking at the General Fund revenue account, we have an underspend of £368,000 against our budget, and this indeed is an improvement of £7,000 on the position that we saw at the end of month 3. This is very largely unchanged and arises from an underutilisation of the development and risk contingency and a lower than projected cost of capital financing. General balances continue to be projected at 26.5 million, which is consistent with the projection of month 3.
Exceptional pressures arising from COVID-19 for 21-22 are projected at 18.8 million. Now, this represents an increase of 2.1 million from the position that was reported at month 3, but I have to emphasise that this is not actually because of increased expenditure, but rather a material improvement in our funding position as a result of a confirmation received that a central government grant totaling 4.1 million can now be utilised. The overall outcome is that we've been able to reclassify projected expenditure, which is originally destined to be met from earmarked reserves, totaling £2.1 million. Total pressures incurred in Hillingdon since the pandemic began in 2019 now amount to £52 million. Agreed central government funding of £21 million is allocated to cover these pressures, and at the start of the pandemic we allocated a further £10.1 million within the earmarked reserves to meet any further items incurred. Turning to our programme of savings for 21-22, this is making good progress. Of the £10.4 million worth of savings budgeted for the year, £2.9 million are now banked and are on track for delivery by the year end. A further £6.5 million is in earlier stages of implementation, but we expect to deliver these. As previously reported, we have a residual £1 million which is at risk, this being the planned improvement in income derived from our recent new leisure centre contract. These savings are expected to be realised in the fullness of time, but are of course delayed as a result of the pandemic. In the event that they are not achieved within the current financial year, they will, however, be covered by central government grants. In aggregate, our capital programme within the General Fund amounts to £297 million between 21-22 and 25-26, and we expect that to be exceeded by £750,000. The major factor causing this is a projected overspend of £5.6 million on the Useley and West Drayton Leisure Centre project, where cost inflation in the construction sector has materially and adversely affected the tenders we've received. This overspend is in part mitigated by an underspend of £3.1 million, which arises from our decision not to finance the acquisition of small equipment and furniture from capital. Turning to the dedicated schools grant, the position remains unchanged, with a deficit of £12.7 million projected for the year, giving rise to a cumulative deficit of £38 million by the 31st of March 2022. This deficit is being caused by an unprecedented demand for high-cost special educational needs places. The Council is now fully engaged in constructive discussions with the Department of Education, which is expected will lead ultimately to agreed remedial measures, including, we expect, a programme of repayments to the Council which should rectify our deficit. The Housing and Revenue Account continues to report very close adherence to budget, with a forecast surplus of £52,000, being a £70,000 favourable variance against budget and a £21,000 improvement on the position reported at month 3. The capital programme within the Housing Revenue Capital account is currently on track with a budget of £232 million over the period from 21-22 to 25-26. However, I must remind Cabinet that revisions continue to be worked on to these capital budgets in order to increase and enhance our housing stock and to reflect schemes such as the Hayes Regeneration Project. I therefore move recommendation 1 within Part A of the report as set out on page 244. Furthermore, Part B of the report, set out on page 264 of the pack, sets out recommendations A to H, which also have financial consequences, which are fully explained in the report. I so move. Thank you, Leader.
Thank you, Councillor Goddard, for such a full report. I very much appreciate your continued keen observance on management of our money, ensuring that we stay in a strong position. So thank you for that. Colleagues, are these recommendations agreed?
Agreed.
Thank you. Now turning to Part B, if we could break the link, please.